Good afternoon, everyone. Welcome to today's session in the Dean Speakers Series. I'm John Samet, the Dean of the Colorado School of Public Health. And I'm delighted to introduce today's speaker, Dr. Cheryl Anderson. Cheryl is professor and Dean of the new Herbert Wertheim School of Public Health and Human Longevity Science. I've known Cheryl since 2005 when she joined the Department of Epidemiology at Johns Hopkins, where I was chair at the time. Her career has taken a remarkable trajectory of accomplishment and meaningful research and actions. Cheryl's work has focused on human nutrition, non-communicable diseases, and underserved populations, areas where she's made numerous contributions. She has led a variety of critical committees, and her administrative skills and accomplishments and knowledge of public health were recognized in her being named the founding dean of the new School of Public Health at the University of California, San Diego. I point out that she's won many different accolades, and most particularly elected to the U.S. National Academy of Medicine in 2016. So for today's session, we are recording. I want you to know that. And also what we'll do is field questions at the end using the chat function. So with that, Cheryl, thanks so much for joining us, and let me turn things over to you. Thank you for being with us.
Thank you, John, Dean Samet. It's wonderful to have had you invite me to do this seminar today. I have to just, tell you how much it meant to me when you hired me into my first faculty position. On my first day of work, after we had a brief meeting, you walked me down the hall, you introduced me to colleagues who were there with their doors open, and I felt like I was stargazing. I mean, I really wasn't sure if I belonged. Here I was, walking the halls of the great Bloomberg School of Public Health. And you introduced me to the other epidemiologists as though it was a sure thing that I was going to be a great success. And as a woman of color in science, that meant the world to me. And it really made me feel welcome, included from the start. You gave me a seat at the table in sitting on your chair's advisory group, so I understood how the place was governed, and really helped me to begin to see the importance of contributing in a positive way to academic life. And so thank you for that early start, and thank you for allowing me to talk with your school today. So I'm going to share my screen now. I hope everyone can see that. Our topic for today is racism is a public health crisis. What are the opportunities and challenges for schools of public health? And, I came to work in the field of public health because I grew up in a neighborhood in Florida. The neighborhood, it makes up a region of South Florida called the Glades. And this is a place where life and health was often threatened by the disproportionate impact that certain chronic conditions, when HIV/AIDS came on the scene, that infection really ran rampant and in a disproportionate fashion amongst the people of color in the community. When I got to college, I, for the first time, found a framework, which was a public health framework, to really hang my early observations in my community on. And I made a commitment really at a very young age that I wanted to do this work for the rest of my life. And so I want to acknowledge up front that, talking about racism and talking about race can be painful and difficult. I've never left a seminar or a talk on this issue without feeling deeply disturbed. I've been grateful that there have been, forums within which we can talk about these things, but it's not a pleasant topic. And so I want to just start the talk by providing us the opportunity to reflect together. And I'm going to ask the question and ask that you put in the chat your response to this question if you feel comfortable. But the question is, what feelings come up for you when you're going to talk about race, about racism, or about white privilege? So take a moment now just to you can write it down on a piece of paper beside you. You can put it in the chat. Yes, I think what we're seeing in the chat right now, feelings of curiosity, trepidation, concerns about being misunderstood, a sadness, a frustration, being scared, because of being a person who's white, being nervous, exhausted, sad, feelings of guilt, discomfort, fear, anger, shame, urgency, hope, commitment, guilt again, feeling unqualified to really speak in this space, feeling challenged, discomfort, a need, a conflict. I mean, these are all, I think, very similar feelings to what any gathered audience would express around this topic. So what I want to suggest to you as we go into this seminar today is that we really cannot do this work on talking about racism, race, structural inequities without using a lens of compassion. Compassion is really essential if we're going to sustainably work on this issue. And so when we get to the other side of this talk, I hope you'll get the importance of how we should remain grounded when we are faced with incidents of racism, how we exercise compassion for ourselves, thinking about sometimes the pain that this raises. And with that pain, it can result in anger. And how we, after we understand our own insights around the feeling that we're having, how do we also think about compassion for other people? Because it can be hurtful to others, and we may often find ourselves in the position of being the one that is causing the hurt. And when someone's causing hurt, how do we show compassion for them? And how do we allow for spaces of growth and understanding? And then, and only then, do we decide how to respond to racism. So there's this, it's a tall order, but I think it's a necessary order if we're going to do this work in the long term without having our schools of public health implode. So in public health, we often think about what is necessary to measure health status, right? We want to know about health status because we want to understand illness. We want to know more about death. We want to know about factors that may be less precise than death, but nonetheless meaningful, quality of life, for example. We want to monitor trends. And the health status of a population can be measured in several ways. I show you here on the screen mortality statistics and life expectancy. And you see on the left side of my screen that life expectancy across the 2007 to 2017 period, according to our National Vital Statistics System, is not uniform in our country. The lowest life expectancy is experienced by those who are Black and not Hispanic. And the best life expectancy is seen in individuals who report as being Hispanic in that vital statistics system. When we think about, I work in cardiovascular disease largely, and when we think about preventable cardiovascular disease death, we see here in deaths per 100,000 over the time period of 2001 through 2010, that non-Hispanic Black males and non-Hispanic Black females experience the highest rates of preventable cardiovascular disease deaths. Last month, just about middle of November, the American Heart Association produced a scientific statement on racism and how racism could be a fundamental driver of health disparities. And this is a table, well, a figure that was shown in that publication. It's the age-adjusted total cardiovascular disease mortality rates from 2007 to 2017 by race ethnicity. And I highlight here what's happening in non-Hispanic Blacks, where we're seeing improvements across all groups between the time frame, but individuals who are reportedly non-Hispanic Black heritage show the worst age-adjusted death rates per 100,000 population. 3 years ago, with colleagues, I co-authored this scientific statement on cardiovascular health in African Americans. And what we saw was that there's a higher prevalence of traditional cardiovascular disease risk factors, hypertension, diabetes, obesity, and atherosclerotic cardiovascular risk. And it was underlying the relatively earlier age of onset of cardiovascular disease amongst African Americans. In the scientific statement, we comment on hypertension being highly prevalent among African Americans, how it contributes to disparities in stroke, heart failure, peripheral arterial disease. And even despite the availability of pharmacotherapies in African American communities, like heart failure medications, disease management was less effective among African Americans, thus yielding a higher mortality. We go on in the scientific statement to really dive into some of the persistent disparities and why we view them as multifactorial, how they span from individual level issues to a social environment issue. We called upon really starting to think through social determinants of health more in the work that we all do in cardiovascular disease epidemiology, and how important it is for us to do this with a broad set of stakeholders. And that was 3 years ago. Now, if we fast forward to 2020, we really have a national conversation that's happening that is forcing us as a public health community, as epidemiologists, as biostatisticians, those who work in policy, health behavior, et cetera, to do better, to think deeper about the things that we have been raising around, the issues we've been raising around race and ethnicity. So this is the publication I mentioned a little bit earlier that came out about 3 weeks ago. It's a call to action, structural racism as a fundamental driver of health disparities, an advisory from the American Heart Association. And in this advisory, they go on to present this figure that links anti-Black structural racism and poor health. And when I just mentioned, we're being called as a community of scientists, particularly those of us in public health, to really dig deeper, to really explain and think about root causes a little bit more plainly so that we can help to advance the agenda of overall and equitable health in our nation. I really was excited to see this figure. So this figure starts with an acknowledgement of slavery having had a centuries-long impact on our country and on our health, to structures that maintain white supremacy in the country, to things that happened post-emancipation and how that led to maintaining white privilege. It highlights Jim Crow laws, segregation, redlining, things that normalized racism, targeted Black people, and exacerbated racial bias within our justice system. And then now, we're starting to think about social determinants of health and poverty and how those things are linked to factors, beyond what we typically cover in public health, but that we must find ways to partner and do in an interdisciplinary way. So you'll see in the middle of this figure that there's that, social determinants of health, which I think, all of us training or working in public health right now understand that concept. But what I'm going to challenge us to do as a school of public health and a community is to take a few steps back on this figure and really, as we do our own work, think about how things like Jim Crow laws and structures of racism and slavery may lead to some of the things that we're seeing at the bottom of this figure with regards to poorer cardiovascular disease and stroke outcomes, or you could name the chronic disease or infectious disease context that you work in, because these disparities often persist across health conditions. We also know in public health intuitively that to accomplish good health, we must look beyond the individual level and to think about the factors beyond the individual within our environmental context, whether it's the family context, the societal context, the political context, that ultimately lead to health. And you can see from this schematic that clinical care matters. Having access to care and good quality care is important. The behaviors that we choose to engage in also matter. You know, the fact that we can have great tobacco cessation programs that impact tobacco use, that we encourage people to have proper diets and excellent amounts of exercise, to really be thoughtful about alcohol use as appropriate and limiting drug use, having appropriate sexual activity, sleep. Those behaviors are foundational for our health. However, when we think upstream, there are other things that are happening beyond the individual's control that also matter: the physical environment and our social and economic environment as well. These things all are fundamentally related to whether or not we see equitable improvements or equitable experiences in health, and they relate to our structures. And I suggest to you that systemic racism is a part of that structure and that it matters greatly for whether or not we're going to experience health. So let's take a little more concrete look at talking about racism here and why those of us who work in public health would think of racism as a public health crisis. So I want to move clockwise through this figure. So we know that structural racism operates dynamically, and that there are aspects of structural racism that really reinforce other aspects. So for example, there's an economic component, and the social resource inequalities that can be traced along racial lines perpetuate and interacts with the political marginalization that can be traced along racial lines, as well as the ideological and institutionalized ideological control, shared beliefs that normalize and ultimately even moralize racism. So what do we mean when we say race? Like, what does that mean? Well, it's important to understand racial formation in the United States in trying to understand what is meant by race. It's a master category. We do not escape it in this country. And it's a fundamental concept that really shapes our history. It shapes our current policies, our economics, our culture. We have the social meaning of race being transformed by political struggles. I see that happening in modern day activities in Washington, D.C. We see how it refers to different types of human bodies. This is a social construct that the complexities of complexion begin to come to bear through this categorization by race in this country. When we say racialization, that's an extension to previously racially unclassified relationships, social practice, or groups. And so I just want to have that shared glossary as we move through this talk. Now, critical race theory, I want to comment a little bit on some of the themes that are present in critical race theory and how we see them in this kind of work. So first of all, a theme that we see in understanding critical race theory is that racism is really normalized. However, we have to consider that this is an outcome of intentional structures in American society, right? It is not something that just happened. It was deliberate in perpetuating and helping to keep the economic engine of our country that was largely steeped in slavery. And then another theme that we'll see in critical race theory is interest conversions. So anti-racist movements, sometimes they make progress when it benefits people in power, not necessarily because of a moral persuasion. So for example, we know how many of you recognize that the Washington, D.C. football team recently changed their name. They're now the Washington football team. They were previously known as the Washington Redskins. For decades, that had been brought to the owner's attention. Quite a bit of discussion was happening around it. And, it wasn't until there was an economic interest to change the name of the team that we started to see that happening, not necessarily for moral reasons. So we should be mindful of how interest conversions can actually provide opportunities. Intersectionality, no one person has a single identity. I talked to you today as BIPOC. I'm a woman. I'm an African-American woman. I'm a mom. I'm a professor. I have not one single identity, and how those things intersect with my racial identification is really key. And then I want to just make the point that centering the voices of individuals who are BIPOC is not anti-white. So, it's taken some time in this country for us to understand the Black Lives Matter initiative and movement, because we, for some time, thought that if one said Black Lives Matter, then why, was that necessary? Why was that centering necessary? You'd hear people ask things like, well, don't all lives matter? And I, just want to say to you in plain language, if I came up to you and said, my mother died yesterday, it is highly unlikely that you would say to me, well, Cheryl, all parents are going to die. You would allow me to center in that grief, that hurt, that space that was necessary to recognize that, my mother had passed away. And so I draw that and make that that analogy because I just want us to recognize that white voices have dominated the discourse in this country for a long time, and disrupting that practice and centering the voices of those who are Black, Indigenous, or other people of color can be essential to getting us into a new space and to shifting paradigms. Okay, so we talked a little bit about structural racism, and I want to show you how that can come to bear with a few examples. So on the economic side, we have lack of access to funding for higher education, impacts then career earnings and job prospects. I've mentioned that there are times when there are normalizations happening within our structures where people cannot generate generational wealth. There are schools in communities that have BIPOC individuals that are underfunded, maintains a working class, and increased police funding, prison labor, wage theft, higher unemployment, et cetera, is some, there's some things that we consider in the economic space. In the political space, immigration policies, thinking about democratic representation and political power within BIPOC communities, because of lack of physical mobility. The amount of education that one has can be linked to the amount of political activism that we sometimes see, fostering some cynicism, mass incarceration in communities. And those have ways of interacting with the ideological, right? That people don't deserve the same rights as others. Maybe, we see them as being here illegally, taking our jobs. Good neighborhoods, should be predominantly white because, whites have the same values and, others might not. Schools that are that have students who are BIPOC aren't good schools, right? Black people, people of color are not intelligent. These ideological perspectives help to perpetuate some of the things that are happening in our country. Another example of racism being normal is redlining. I don't know how many of you are familiar with this concept of redlining, but I clipped this schematic from a New York Times article that was published not that long ago. And it sounds really odd to say something like, well, racism is normal. But I mentioned to you when we examine critical race theory, this is one of the themes that come out. It's really the outcome of these intentional structures in our society. And in redlining, there was a systematic denial of various types of services by federal government agencies. These things were legal. Local governments, the private sector, either through some direct actions or some indirect actions. And prior to the Fair Housing Act of 1968, there were no specific laws that protected BIPOC communities from this kind of action. So this practice of redlining was utilized in the housing industry. They would draw these red lines around communities that mortgage companies could legally suppress minority populations from receiving home loans to move into those communities. And at the same time, individuals were also being denied funds to improve the status of their current homes. And so it was really difficult, and it was happening all across cities in America. We have evidence of it having happened right here in San Diego. What do we mean when we say a policy or an outcome is racist? Well, racism has been happening in a way that creates and reproduces structures that dominate based on racial identities. We also have a need to focus on the outcome of these policies and the consequences of these policies rather than the intention. In today's day and age, you rarely will hear anyone say, well, I intended for that action or that policy to have this outcome where, you know, some racial ethnic groups benefit more than others. Nonetheless, the consequence is still important to make note of. In some ways, when we say something, a policy or an outcome is racist, you can hear people inflating racism and saying we should just have a colorblind society. And you can also, you know, hear arguments for deflation of racism, reducing it to, you know, specific acts of hate or hate speech. And of course, you know, in America, hate speech is debatable because of our right to free speech. So I want to share with you right now a video. And I hope to have this video illustrate why some of us would say that racism is a public health crisis. And so I'm going to stop sharing my screen for a moment and share another screen with you. Okay. So I hope everyone can see that.
I would like to add someone to our group here. Professor Paul Weiss, a Sterling Professor of Philosophy at Yale. Were you able to listen to the show backstage?
A good deal of it, but then I was behind the rostrum.
Yes.
So I heard only some of it.
Did you hear anything that you disagreed with?
I disagreed with a great deal of it. And of course, there's a good deal I agree with. But I think he's overlooking one very important matter, I think. Each one of us, I think, is terribly alone. He lives his own individual life. He has all kinds of obstacles in the way of religion or color or size or shape or lack of ability. And the problem is to become a man.
But what I was discussing was not that problem, really. I was discussing the difficulties, the obstacles, the very real danger of death thrown up by the society when a black man attempts to become a man.
All this emphasis upon black men and white does emphasize something which is here, but it emphasizes it or perhaps exaggerates it, and therefore makes us put people together in groups which they ought not to be in. I have more in common with a black scholar than I have with a white man who's against scholarship. And you have more in common with a white author than you have with someone who's against all literature. So why must we always concentrate on color or on religion or this? There are other ways of connecting men.
I'll tell you this. When I left this country in 1948, I left this country with one reason only, one reason. I didn't care where I went. I might have gone to Hong Kong, I might have gone to Timbuktu, I ended up in Paris, on the streets of Paris, with $40 in my pocket on the theory that nothing worse could happen to me there than it already happened to me here. You talk about making it as a writer by yourself. You have to be able then to turn up all the antenna with which you live, because once you turn your back on this society, you may die. You may die. And it's very hard to sit at a typewriter and concentrate on that if you're afraid of the world around you. The years I lived in Paris did one thing for me. They released me from that particular social terror, which was not the paranoia of my own mind, but a real social danger visible in the face of every cop, every boss, everybody. I don't know what most white people in this country feel, but I can only include what they feel from the state of their institutions. I don't know if white Christians hate Negroes or not, but I know that we have a Christian church which is white and a Christian church which is black. I know, as Malcolm X once put it, the most segregated hour in American life is high noon on Sunday. That's a great deal for me about a Christian nation. It means that I can't afford to trust most white Christians, and certainly cannot trust the Christian church. I don't know whether the labor unions and their bosses really hate me. That doesn't matter, but I know I'm not in their unions. I don't know if the real estate lobby is anything against black people, but I know the real estate lobbyists keep me in the ghetto. I don't know if the Board of Education hates black people, but I know the textbooks that give my children to read and the schools that we have to go to. Now, this is the evidence. You want me to make an act of faith, risking myself, my wife, my woman, my sister, my children, on some idealism which you assure me exists in America, which I have never seen.
Fast. Actually, just had it happen the other day when I was.
Okay. So let me come back to the slide set here. And I just want to acknowledge what Kamal Henderson put in the chat. James Baldwin's ability to explain how America's caste system impacts our society remains unmatched. He inspires how I think about these complicated issues. Thank you for that, Kamal. So what you may have noticed, I'm sure Dean Samet noticed the cigarette smoking that was happening, firsthand, secondhand, likely thirdhand smoke as a public health crisis of the time. This video was taken back in 1965. And for those of you in the spring of this year, in the wake of the highly visible injustices against Breonna Taylor, George Floyd, many others whose names we don't know, and that conversation happening all across America was so similar to what we just saw in the conversation that James Baldwin is having on the Dick Cavett show. So these are longstanding issues that have been, we've been trying to make our way through for an extraordinary long period of time. And right now in our schools of public health, our students are saying we must do better. In fact, our students called for a meeting with me as the dean back in June of this year. And when I listened to them, the first thing that came to my mind was Representative John Lewis, who was a part of the Student National Coordinating Committee fighting for civil rights and had his skull fractured as a part of that fight. Having been working in the area of peace and justice as a congressional, Georgia's, 5th District House of Representative member for all of these years, was their age. He was their age when he was calling for the very same things that they're having a meeting with me around. So I also, know that our employees within our schools are saying, look, we turn to our workplaces for inspiration. We want our workplaces to be that place of leadership. And so we now have permission to take things even farther back in terms of trying to address root causes than we as schools of public health have previously been doing. So I suggest to you here that while we know that equity is a core value for public health schools, public health schools have probably more than any other discipline long identified racism as a public health crisis. And I like this schematic from the Robert Wood Johnson Foundation because it shows us the difference between equality, assuming that everyone's going to benefit from the same support, where here, 3 individuals are trying to see the game, you give them all the same thing, and they're still not able not everyone is able to see the game. When you think about equity, you would match the support to what is actually needed. And here you can see that everyone now has a chance to look at the game. However, I would say that in public health, we're really trying to get towards justice, right? Our field is the intersection of science and social justice. We're trying to understand what are the root causes of these inequities and how do we remove systematic barriers. So with that in mind, as the dean of a brand new school of public health, I want to just share with you some of the things that are top of mind for me as I think about what are some of the opportunities in the midst of this really important time in our history. So one is we can develop strategic plans. And I think you all have done this at the Colorado School of Public Health. Understanding what do you want to accomplish in the space of trying to be an anti-racist institution? How are you going to accomplish it? What are the clear strategies that need to be executed? And then what does success look like, right? We know that we need to measure what matters. And so do we have clear metrics and data so that we can hold ourselves accountable? We also want to re-examine our current policies and practices and think about the things that we're going to do down the road. So you now have an EDI officer, right? Someone who is, as an associate dean, focused on equity, diversity, and inclusion, and thinking about that from a faculty recruitment and retention perspective and a mentoring perspective is important. Faculty cannot do the work without the staff, that really the wind beneath our wings, thinking about our staff hiring practices, how staff get merit advancements, the climate that we ask them to work in, and the practices that we engage in from day to day with each other. Our students will need to think about policies and practices that we have around admissions, around financial aid, and then of course within our business offices, how do we manage purchasing and contracting so that we can get out of some of the racist structures that we've currently built for ourselves? And then within our classrooms, really thinking about expanding anti-racism curriculum, defining core anti-racist components of our curriculum. How do they integrate into many classes versus just being the topic of one class? How do we develop leaders of change so that when individuals leave our training programs, we send them out into a world where they foundationally understand what is happening with regards to structural racism and work constantly to be the voices for change in this space. And of course, we want to develop an advanced training, just as we would for any other competency within our programs, so that we can really have the opportunities to dismantle institutional racism. In addition to thinking about the curriculum, I think some training for teachers is something that I'm sure you all have discussed there and that many schools of public health are discussing. How do we ensure that we have educators who can champion sustained change in this space? In the California, University of California system, we have right now some efforts to create brown belts and black belts across our teaching core that have specializations in anti-racist pedagogy. These school-wide trainings, I think the benefit of them are to build skills for anti-racist pedagogy, help us to engage the school community in some difficult conversations around race and racism, help us to assess positionality, how do people manage through being bystanders, how to encourage and receive racial feedback. As you could see from our early comments in the chat, that can be very difficult. And how do we develop a growth mindset around becoming anti-racist? Because this is incredibly hard to do. So here at the Herbert Wertheim School of Public Health at UC San Diego, we've engaged in a school-wide training where every single staff member, every single faculty member, and then we have classes where we can train more students at a time. So we do those in larger cohorts. Engage in what we have termed a racial resilience seminar series. And this is 24 hours of training. 12 hours is within the classroom, and 12 hours are activities that are done outside of the classroom. And I just want to tell you a little bit about what we think of as the purpose behind this. So right now in our undergraduate programs, we have quite a bit of diversity with individuals coming from underrepresented groups. We have a good representation of individuals who receive Pell Grants, which is our indicator around socioeconomic status or income, and who are first generation in their families to go to college. However, as we move into higher levels of training, our master's programs, our doctoral programs, our biostatistics PhD in particular is one where we start to see that diversity go away. And we would like to try and have the kind of school that will attract individuals to work in these really important disciplines. So this seminar that we have is really based on the fact that racism is systemic. That's the departure point, and it's embedded in the structural foundation of our US economy, of our US policies, and the ideologies that many people in this country share. It's taught by two professors from a local university, the University of San Diego, which is different from UC San Diego. And they have encouraged us to do these 5 things. One is be able to situate origins and development of racial thinking through the Euro-American Colonial Project. We understand and really define racialization, racism, racial projects, colonialism, white privilege. Importantly, as I mentioned earlier, we talk about compassion and how compassion works within us and toward other people. We apply this methodology and participate in conversations around racism. And these are probably things that many of you at the school are also thinking about as you engage in your own anti-racist work. And I want to say that the class is relatively easy compared to what happens when you've finished laying the foundation and teeing an organization up for success, and then you actually have a challenge. So in addition to the various topics that we cover, we ask people to come up with a personal plan that they're going to use to address racism in some way, and then share that action plan with small groups at the last session. So I just mentioned that, the foundation and having the opportunity to put a strategic plan together is necessary. I think many people are doing that right now in our schools of public health. However, capitalizing on that opportunity doesn't leave us always well situated to manage through what happens when there's an incident. And I mentioned before, racism is normal, so there will be incidents within our schools. And I want to share this case study with you where we are having, names and identities have been protected here so that we don't we can consider this to be a fictional example. But so let's say, for example, the agenda for a well-attended school event, something maybe like the one we're having right now, includes remarks from a major donor to the school. And a comment is made by that donor in the first 10 minutes of the event. That comment is racist, it's xenophobic, and the event has an additional roughly hour to go on. What should be done? So I'll tell you maybe one of the places to start is to have some community guidelines, engaging in open and honest dialogue, allowing people to speak from personal experiences, listening, being present, exploring unintended impacts, respecting and maintaining confidentiality, not expecting closure with any early conversations, and trusting that through dialogue, people will get to a deeper level of understanding. In this case study, I would come back to that compassion angle to say that we need to not normalize or ignore the incident, right? Something happened, it has to be dealt with. I would say the leadership in the school needs to deal with it as soon as it's appropriate, probably not in the event, because we can be very reactive when things first happen to us, and we need to be grounded before we decide on actions. We want to provide a space for individuals who were harmed. So in this case, we talked about the centering of voices, centering of the individuals who may have been most harmed, or for whom the insult was targeted towards, so that they can discuss the incident, exchange ideas. So I would say within the first 24, 48 hours, that space needs to be created. And it's helpful if within our schools, we have ongoing places where this happens routinely in our environments. Want to make sure we can listen to each other with compassion, and then facilitate that growth and understanding, because the person who perpetuated, or the people who perpetuate these actions often do them unintentionally. And we need to have environments where they can understand why what was said or done was problematic, and how to grow and move from that space. Otherwise, we will not be able to do this sustainably. Our schools of public health will be constantly in a non-harmonious state. And we should try really hard to not reduce individuals to their worst mistake. So I have a part 2 here to this case study. So a forum is then held to discuss the impact of the incident and next steps. And in a passionate plea by a student in the forum, a racist comment is made. What should be done? So first, we have a situation where, a prominent a member or contributor to the school makes the mistake, and now the community is rightfully disturbed. There's a lot of pain, there's a lot of anger. In the midst of discussing it, one of the students makes a comment. So I would go back to challenging us to go through this same idea. Don't normalize it or ignore it, but also don't embarrass people. Provide spaces where this can be managed through in a healthy way, whether now maybe the right space isn't a large community forum because it's a student issue. Perhaps it's the student with a mentor, a trusted advisor, where the situation can be discussed in a way that isn't going to, again, reduce this person to their worst mistake, and that they don't feel like there's compassion for them or an opportunity to grow within the community. So I'll bring this case study just to closure here by saying that in addition to the forum, because you can't expect closure on these things very quickly, a team of individuals within your school, they get together, they prepare a document that attempts to address this incident that included the major donor. And that document, turns out, shows up with racially insensitive comments. What does one do then? Right? Just reminding us how these things can happen even with the best of intentions in schools that are working really hard to be anti-racist. So coming back to these principles, acknowledging it, not ignoring it, but doing it again in a space where it can be talked through. In this instance, I might encourage people to share about maybe times when they have done something where they were in need of compassion and a bit of understanding, so that people can see how this happens and develop and build that compassion toward others. Listening, facilitating, again, growth and understanding, and showing how we must do this compassionately, because all of us are likely to be sitting in the need of being forgiven, or being having someone receive our apology for having made a mistake, with some compassion. So I just want to close here by saying the opportunities for our schools of public health are really quite significant and substantial at this time. And within schools of public health, I think we are often wired to want to do something. And how we do things matter, right? So we can take several approaches to doing something. We can do something to someone, which is probably not the way we typically like to go about operating in schools of public health. We don't just go doing things to others, right? We could try to do things for others. That's common, but in schools of public health, we probably, take that to another level where we really strive to do things with others. We create partnerships. We want to not only create these partnerships, but think about how we can expand capacity within the partnerships that we create, so that communities or individuals become agents of change. And so eventually we transfer and have things be done by communities, because we have those partnerships with them. So I will pause here by saying thank you once again for inviting me to participate in this incredible lecture opportunity. I believe that we have difficult work to do, but that we are being called to be peace and justice warriors in this time. And to do that work sustainably is going to take quite a bit of courage. I love this quote by Dr. Maya Angelou, which is, "Without courage, you can't practice any other virtue with consistency. We can't be kind, true, merciful, generous, or honest." So at this time, I will take your questions.
Great. Thank you so much, Cheryl. That was so thoughtful. And I hear applause thundering across Zoom land right now. You had me right. Of course, the cigarette just jumped right out at me. And probably everybody else, since it seems so strange now. There's several questions that have come through in chat, and I'll just briefly summarize. One relates to strategic plans, which you mentioned, and the question of how you do meaningful evaluation. And I guess the commenter's point is that very often those who make the plans may have their own lens for viewing outcomes, and how do we get a broader, more holistic assessment of what we've done with our planning?
Yeah. So this is it's key, right? Our ability to figure out our success is going to be hinged on whether or not we evaluate and how well we evaluate it, and do we actually have a chance to get at the things that truly matter. And not everything that matters can be measured, and not everything that we measure actually matters. And so when I think to do this work with integrity is we have to be very honest with ourselves as a leadership of our schools, as well as with our constituents of the schools, to say really what matters for us. In my work so far, I will tell you, when the students come to me and say, I want to do a survey to prove that there's racism in this school, I say, that's not necessary. I understand. I trust you when you say to me that you feel microaggressions, you are experiencing racism, because I have a broader understanding of, kind of the history of race in this country and how it operates. But I recognize that maybe not all leaders are going to take that perspective. And so they're going to challenge their constituents to generate data to show that there is a problem. right? And so I think that's one. I mean, do we need to engage in surveys and right? So I think it's really about sitting down and in a way that has a lot of integrity and that really creates open dialogue, talking with the constituents of the place, centering the voices of BIPOC members of the community, figuring out what matters and how do we, through whether it's qualitative or quantitative means, track on those things that truly matter when it comes to doing anti-racist work.
And I think a somewhat related question refers to efforts at the school to develop course evaluation questions that relate to discussions of race, anti-racism, diversity, equity, and inclusion. And I think in what should be a process of sort of iterative feedback and improvement. And the question relates to the construct of such questions, the willingness of the faculty to hear the answers, and I guess what we do as a school to change as we learn what these evaluations are telling us.
Mm-hmm. Yes. And I think, John, a part of that is with some foundational knowledge about how things come into our lexicon, how we experience privilege and power, and the dynamics that the dynamic ways in which that can show itself in a classroom setting. If with humility, with true cultural humility, we enter into our classroom spaces, I think it's easier to hear that feedback. And in fact, we may crave that feedback because we want to do a better job than we're currently doing. And we all have biases. It's what we do with them that matters. And creating a school culture where it is an expectation that we want to hear when there is an offense, and we're not going to, again, reduce everybody to, walking the plank when a challenge faces us, but that we're going to, with earnest intentions, listen to it and try to move beyond it. I think is what makes those evaluations. Makes us actually want to do the evaluations and puts the real integrity in the evaluation process and the trust that there's something will happen on the other side of it.
Thank you. And then here's a really important question that is complex, and it really relates to how do we do research in community contexts, engage communities, challenge traditional power dynamics. And the question starts off with a reminder of the history of unethical research in disadvantaged communities. So the question ends with, how does this fit into our anti-racist public health work and to how we educate public health students?
Yeah. So I would say here, this is where, again, sort of an honest acknowledgement of where things have not always gone right can be very powerful. Sometimes, well, I hope that in schools of public health, when good schools of public health, when people come out of them, they understand that, we don't work on communities, we work with communities. We do stakeholder engagement. We understand needs, and it's not that we go in with our own agendas and just, start to make things happen. And so if we take that approach, I think that we can honestly acknowledge what happened in previous worlds and activities. We explain why we're showing up differently this time, and we ask for the community's indulgence, really, of us and the things that we're trying to move forward on. Now, those things that we're trying to move forward on should be shared goals. And within how we operate from a health framework can also be racism, because we've defined for people where they should be going, when they should be going there, how they should be doing it, from our own positions of power and privilege. And so coming to some shared norms there can be helpful. I also want to say that, what I'm finding as you know, we try to build our school, is that some of the barriers to doing this work is that it's so much easier to let things slide. It's so much easier to pretend like we never had a Tuskegee syphilis experiment. And I'm sorry, we're not going to shift this paradigm. We're not going to get success without putting in a tremendous amount of work. And we, you know, need to maintain our commitment toward it. And we need to just remember that none of us are going to be perfect in the way that we approach it. And if we hold everyone in the beginning of this work to these impossible standards of, you know, knowing the right things to say all the time, knowing the right things to do all the time, when it comes to anti-racist work, it is not going to continue. We're going to have to be willing to fail. And through those failures, we will find our successes.
Thanks. Even though we're out of time, do you mind hanging around for a few
I
more
would
minutes?
love to hang on a little while longer.
Okay, thanks, Cheryl. Just I think sort of a follow-up, and I loved your point about creating a, quote, growth mindset for becoming anti-racist. And moving from I'm not good at this to I have to keep working to get better. Can you provide examples or strategies, messages that have used worked well to move in this direction?
Yeah, so I think within those guiding principles that I shared is a growth mindset, right? Because the first thing is, we're gonna fail. We're creating an anti-racist school culture, environment, policies, you know, procedures, the whole nine. But because of the greater societal constructs around us, we know that this is not the default in our nation. And so we will fail. We will have instances of racism. So just there alone, from the very, you know, sort of first acknowledgement that this is normal in our society right now, suggests that we need to be in a growth mindset because we're going to have to work at getting better at this. And then in the creation of spaces for people to share how they're feeling, to exchange ideas, we won't be able to do this work over the long haul if we get stuck and refuse to find ways forward. And so in those spaces, yes, we need to feel as though we can acknowledge the issues, and we need to be able to have processes that allow us to have restorative justice, to get to reconciliation. And those things require a good deal of self-awareness, and it requires a good deal of empathy and compassion for one's neighbor, because you cannot get stuck. If you get stuck on the one incident, or you know, the third incident or the fourth incident, it's this anti-racist trajectory that we're all hoping to shift and have, you know, tremendous momentum toward is just going to stall.
So there's several more questions. I want to apologize to the questioners because we probably can't get to all of them. I did want to ask for any reflections from Cerise Hunt, who is now in her second day as Associate Dean for Diversity, Equity, and Inclusion. So Cerise.
Well, first of all, Dr. Anderson, your talk has been phenomenal. I really appreciate you grounding us in the compassion. Because I think that sometimes there's so much emotion that's flowing when we're when we're having these discussions around race, racism, dismantling structures. There's so much energy, but compassion seems to kind of center that. And then I also appreciate how you said, and the courage, and you have provided us with so much concrete actions that as a school that we can take. I think that oftentimes we hear like, well, how do I do this? And how can I translate this into action? And whether it is, you know, training institutes, ongoing education. So I just want to just say thank you, because as we're formulating and as we're moving from planning and we're transitioning to action and critically doing the work, that needs to be done. You have laid such a powerful foundation. And so thank you so much for being here today.
You're welcome. Thank you for having me, and congratulations on your new role.
So, thank you.
Thank you. I suspect we could go on for a long time, but again, I think I just want to thank you, Cheryl, for sharing your insights. We'll be hoping to learn from you and your school as you move forward, and then we'll have an opportunity to interact at ASPPH and elsewhere. And of course, next time you interact with the school, it has to be in person.
I love that.
So we can get you out here. You might want to leave San Diego and come experience some real cold weather.
A real winter.
A real winter. Right. So again, thank you for speaking with us today. It's been a pleasure. Thank you.
Thank you for inviting me.
For being with us today.
Yeah, I look forward to meeting you all one day.
Goodbye, all. Bye.